Hi, in this video I'd like to talk about the liver, its basic function and physiology, and then move on to discuss liver diseases, the kind of clinical symptoms and classes of liver disease that typically affect people. First, the liver is the largest organ in the human body. It is supplied by both the portal vein. It is part of the portal system in which a lot of the blood from the intestines leave and enter the liver for filtering and digestion, and also the hepatic artery. This is a unique system in which the portal vein actually supplies 70% of the blood, and the hepatic artery only supplies about 30% of the blood. And the blood leaves the liver to enter the hepatic vein, which eventually goes to the IVC. So in addition to being the largest organ in the human body, the liver is crucial for energy metabolism. In particular, it's important for the synthesis of protein, such as clotting factors. In fact, if you have liver disease, one of the first signs is bruising because you aren't clotting regularly, or you're more prone to clotting. Lipids. The liver is the site of glucose metabolism. A lot of glucose is stored in the liver, and it creates a lot of the fat that is distributed throughout the body, as well as enzyme metabolism. The liver synthesizes important enzymes such as alpha-1 antitrypsinase or alpha-1 antitrypsin, which is crucial for the lungs to prevent scarring and destruction of the walls between alveoli, which causes emphysema. In addition to synthesis, the liver is also responsible for detoxification and excretion. So one of the main reasons why the blood after being absorbed in the small intestines go through the liver is that there are a lot of different neurotransmitters, a lot of different chemicals and toxins that can affect the human body and that are normally digested but needs to be broken down and just detoxed in the liver before it goes through systemic circulation. Another sign of hepatic or liver failure would be hepatic encephalopathy, in which toxins are not normally processed by the liver, which causes an abnormal mental state. This can be as simple as changing sleep-awake cycles to something as severe as coma. Also, the liver is important for secretion of bile acids and bile salts. In fact, the only way the human body excretes cholesterol is through the liver. In terms of liver cells, liver cells are organized into typically polygonal shapes, typically like a hexagon, called nodules, in which in the center is a central venule, and on each of the corners is a set of three tubes, which are the three tubes that stem from the liver, which includes the bile duct, the portal vein, and the hepatic artery. So what you'll notice is that oxygen comes from these structures from around the various corners and go closer into the center, as well as bile or a lot of the other secretions from the liver goes on an outward direction, which goes closer towards the bile ducts. Because of this structure, there's actually a orientation in the different types of liver cells, the hepatocytes, and what kind of functions they do. They're typically organized into 3 zones, which relate to how close they are to the blood supply. The one furthest the one closest to the outside, is known as zone 1, and that sees the most oxygen. This is the closest to the hepatic arteries, and this does a lot of the oxidation, a lot of the redox, um, the redox reactions that are required of the liver. The furthest in will be the zone 3, and this does a lot of the reactions that doesn't require a lot of oxygen, such as the detoxification of toxins. So after we move on to this very brief, quick summary of physiology, let's talk about clinical symptoms. What happens when the liver fails or there's trouble with the liver? One of the first signs a person would typically notice is jaundice. Jaundice means an increase in bilirubin. Bilirubin is a breakdown product of hemoglobin. Hemoglobin is typically in the red blood cells, but the liver and the spleen often does a really good job of cleaning up the byproducts of its degradation. When you have too much bilirubin and you can't excrete it, either because of liver failure or kidney failure, you get too much bilirubin, which accumulates in the skin and causes this yellow tint, hence the jaundice, and can also cause other symptoms, such as scleral icterus, which is when the eyes look yellow because of a similar mechanism. In addition, some other non-specific signs are right upper quadrant pain, the signs of portal hypertension. Portal hypertension, once again, is when the liver isn't working very well. So blood that typically comes from the GI tract into the liver is blocked up and there's more fluid there. This causes ascites, which is fluid in the stomach or the abdominal region, can cause GI bleeding, in which varices are just like they overflow and sometimes might explode or burst. It can also cause splenomegaly, which is in which the spleen enlarges because of an increased blood supply to the spleen, and this can also cause hepatic encephalopathy. Once again, it's the mental state. In addition, a couple of other non-specific signs include weight loss, anorexia, and nausea or vomiting. These signs usually aren't specific, but there's a couple of other signs that are a little more specific to various types of hepatic disease. One of these signs is light stools or discolored stools and dark urine, which is, in addition to the jaundice, another sign of decreased bilirubin excretion. So I'll just write a B here. The second sign would be fever and chills, which is typically a little more specific for cholangitis, which is inflammation of the gallbladder or the duct of the gallbladder. In addition, there's also there can be epigastric pain, which is pain in the center top of your abdomen that radiates to the back. So epigastric pain, which is typically a very sensitive sign for pancreatitis, as well as pruritus, which is generalized itching, and this can be a sign of cholestasis. Cholestasis refers to an occlusion or blocking of the bile ducts, which causes bile acids and fluid to stay static in the ducts and that region of your liver and the ducts there.